Welcome, everybody. Today's guest, we have Miles Salisbury, who is a psychologist up in Oregon, and I've had the pleasure of knowing this great man for the past year and a half in my life. So, Miles, I'll hand it to you to introduce yourself, and if you want to say anything a little further there.
I like sports, as you can tell. If you're watching this, I got my Eagles gear on. I still got to rep the Eagles because the season's about to start, and I'm wearing my champion shirt just to let everybody know that the Eagles, in fact, did win the Super Bowl. Yeah, I'm technically called a depth psychologist. I got my PhD from Pacifica Graduate Institute, my master's degree from Naropa University, where Mr. Dewey Freeman went, and Michael Gay. People who are in our field may know that. And my undergrad was in psychology at Western Oregon University. Those are my bona fides. We've done a lot of trainings on the side, and you've been doing a lot of those with me, which has been cool. Work with Connor Beaton, work with Trevor Boehm. Those guys are rad. They've been really, really helpful. It's been really cool to get to know them. I work with a lot of men, some women, and I do men's groups. I don't do couples work. That shit is not in my wheelhouse, let's say. It's you got to know what your lane is when you're a therapist. That one's way too activating for my childhood trauma. And it's really hard to stay impartial. And I know that, so I'm not going to do it. Mm-hmm. But I love everything else. And I don't do family therapy. I'm not trained to do family therapy. That's just like, whoa, I need another facilitator for that one. But my jam's one individual. That's mostly my jam. And men's groups, they're good. I do psychotherapy, and I also do coaching. So if people want to do either or, they can go on my website and sign up. You can decide. Because if you're in Oregon, you can do both. But if you're out of state, you can only do coaching because my license only allows me to do therapy here. So there's that. I don't know.
That's beautifully stated. Okay. So actually, that spurs a couple things what you were talking about earlier of where you had boundaries as a therapist of like, okay, I don't do that because certain places I know about my own wounding and my own self. Mm-hmm. And where I was really hoping to go with today's discussion is talking about what really makes a great therapist or a coach. And I think some of those areas you're diving already in or talking about with the boundaries is a great place to start.
Sure. Yeah, you got to know. And it's hard to tell at first when you're doing in your training. When you get to your internship or right before where you're doing practice stuff, you'll start to get a feel for what you like. And some programs don't even teach you couples therapy. And some programs are marriage and family therapy based, like LMFTs, and you'll get that there. You'll get couples therapy, you'll get family therapy. So if you're looking for a couples therapist, the LMFTs are really good at it because they get the training. It depends on what school you go to. I got hardly any training in couples therapy. It was mostly training you to be an individual therapist or a group therapist. So that's just kind of what I stayed with. I did try it early on, mixed bag. I could do it, but I just felt drained doing it, and a lot of old stuff coming up. For me, when my parents got divorced, I saw a lot of rupture and zero repair. I don't even know if repair happened. So I misinterpreted conflict as it's terrible. People are going to leave. Bad shit's going to happen. And so I get really triggered and activated in session and like not impartial. Like if I could tell one person was the bad guy in my mind, I would have a hard time being impartial. I think that's hard for every therapist. But it gets better as you go on. But you really have to do your own therapy, do your own supervision. One way to know if you're seeing a good therapist is ask them, hey, do you do your own therapy? Do you see a therapist? If they say no, fucking run. Because you take on so much shit and you have your own shit. And if you're not metabolizing that shit, you're constipated and it's going to come out on your patient or client. And that's no bueno. So that's a good pro tip for anybody looking for a therapist. Ask them, do you see a therapist or do you have a supervisor? And if they say yes, that's a good first step. But yeah, you got to do your own work a lot in this field. It never ends. The That's the good thing and bad thing. There's always something more to learn, another book to read, another training to do, another podcast to listen to. It's also fun. I also enjoy that. If you don't like that, it could be problematic. So another thing to keep in mind. But yeah, just kind of know yourself, know your narrative, your history, what you still need to work on. And a lot of that you
as a
don't
therapist,
know.
right?
Huh?
Speaking as a therapist or a coach or anybody in that
Oh yeah,
field that's
100%. Yeah.
supporting others.
Yeah.
Yeah.
Especially a psychotherapist.
Yeah.
Coaching, it'll definitely land in coaching for sure. But
Yeah.
I think coaches maybe can get away with it more because you guys are more like coaches and directing and giving advice and like guiding. In therapy, it's more like you're empowering the patient. You're not telling them what to do. We're not in the advice giving business per se. If they ask for advice, we'll almost do the cliche therapist question of like, oh, why do you ask me that? Answer a question with a question, But that's kind of the point. We don't want to disempower. So psychotherapy is different than coaching in a way. There's a lot of crossover, but it's a slightly different process.
I was hoping we could dive even further into that part about your own wounds, and speaking more in general of like the wounds that come out within therapy, or I've even seen it in coaching, towards a client, and where, like, yeah, for a good therapist, they would put a boundary to say, no, I just know I can't handle this type of client or this side of therapy. I was hoping to go even further into that.
Like, what do you do about it if it comes up?
Just more in a sense of understanding that maybe when a therapist's wounds start to integrate into a session rather than it's actually supporting the client, it is now negating or their ability to, or even pushing that client down further because of those wounds that are there instead of helping that.
Yep. You gotta check your system when you're working with them. There's, I think Freud came up with it: transference, countertransference. People will transfer their stuff onto you, and then you get a hit back as countertransference towards that person. And you have to separate: am I feeling this because of my prior history, or am I feeling their pain? And kind of you're holding and juggling a lot in session, and so you want to be aware of that, because you're gonna get triggered. I promise you. A lot of mirrors are held up. If it's so overwhelming, that's when you got to refer them on to somebody else. Say, hey, I think I'm your guy. I think I have these good referrals that might be better for you. I think they would be better for you, a better fit kind of a thing. It's a fit thing. It's like any relationship, like friend wise, romantic wise, therapy and coaching is not that different. Like there has to be a chemistry, good fit.
It has to be a relationship.
Yeah. It's not like going to the fucking dentist. Like dentist will get that cavity out and Bob's your uncle. But with psychotherapy, it factors. It's a human, it is an intimate relationship. And that can get dicey.
And I mean, taking it from the approach of a client to a therapist, if they're feeling this all of a sudden shift of where that therapist wounding is now coming back onto them, that shift in feeling is like, I don't feel safe.
Yeah, that's not good.
Like I'm the problem now.
Again, correct.
Even though
that's not good.
That session in therapy, I'm guessing, wouldn't go that way. That to say, oh yeah, you are a problem. You are this.
Unless the therapist is a psychopath and somehow made it through fucking grad school. Those guys usually get weeded out. Like the attrition rate in the first year, man, once you start doing like interpersonal work, they dip out real quick.
But that transference is what I'm thinking of. And how, one, being a client, I would see that happening with a therapist. Or starting to.
Yeah, if you feel that way towards your therapist, tell them.
Yeah.
Like, I feel like this is happening to me, or I feel like you're not listening or not hearing me, or that's great information for a therapist. And a good therapist will take it and go, oh, thank you for telling me. Like, let's work with that. Because we have blind spots too, and we might be doing that unintentionally. So just say what's happening for you. That's like rupture and repair right there. There was a little rupture, then we repaired it. Now we're closer for it. That's what we're trying to do, and that's great. Speak up, say something. If you're not getting shit out of your session, say that. Hey, I don't feel like I'm getting shit out of this session. We're going in circles. You don't have to say it like that. I'm just more blunt. But a good therapist we're trained, well, a good training program will train the therapist to take that and know what to do with it. So it's absolutely a factor.
Uh,
I don't know if that answers your question. But.
no, it does. And actually, I want to dive further into that relationship building with a client. Because I know in working with some of my clients, some of the best things has been building a coach client relationship
Mm-hmm.
for the best support I can provide them to get them to where they want to go and also what they truly want to go and be. And so I was, from your viewpoint, building a relationship with a client to where it can build trust to where repair can actually happen internally for them.
Yeah.
And also what you beautifully stated of a rupture even between the two, but still be able to come out okay. Because you get angry at a therapist and say, well, it's actually okay that you're angry at me.
You're supposed
It
to.
might be a rupture. And I hope, if we were doing things right, there's a majority of us that probably would be angry being poked at in certain ways.
Yeah. I
So
got
yeah,
really
I'm
angry.
angry and be able to share. I'm angry with you right now.
Totally.
Yeah.
Yeah. I've been pissed at my therapist multiple times and we talked through it, and it's been great afterwards. Like she's told me I can leave the room if I need to. Like if I'm being persnickety or like I'm not, she's like, you feel free to leave, man. Like, and that got my attention. Like she's really good. Like
Yeah.
she'll call me on my shit. But we'll talk about how that was, and like there's some underlying wounds there, and that's the juice you're trying to get to. That's just it shows up as a wrapping paper, but what's in the box is what you're trying to get to.
Yeah. Let's talk even further about that relationship, because one thing I do want to know or note out there for those listening, it's a relationship can't be built with like 1 to 3 sessions with a
No.
therapist or coach even. It's over time. And when you think about it, and I love the math that I hear Dewey talk about, it's like, okay, so if you meet with the client once a week for a whole year, you're only getting in, what is that, 48 hours for that client in total? And that's every single week.
That's why I don't get short-term therapy unless you have like a very minor problem. What's even going to happen?
So that's the question. It's how far can you get in 48 hours?
Topically.
Yeah. Maybe the trust gets built at that point, the relationship to a point.
Yeah, the trust gets built. The therapeutic relationship gets established, or rapport gets established. That can happen. I don't know, within the first 4 weeks, maybe 2 months.
Yeah,
it depends on if you click, if it's a good fit, that you can get somewhere. But yeah, 3 times, you're not getting very far, unless you're spending like a couple hours in the session, like a Jungian style where you're coming 3 days a week for 2 hours or whatever. They really hit it hard. Then maybe, but that's a lot of time.
Yeah, it'd be some intensive therapy.
Yeah, that would do it.
Yeah. I think that's a good place to think about too when you're looking for therapists is, are they trying to push right into the first session, right into the deepest topics, the deepest places?
Right. Yeah,
is that a good thing or a bad thing? That's actually something I wanted to ask you.
No, it's not a good thing, in my opinion. Unless they want to go there. It's like, so that time I noticed in your intake paperwork that you were raped by your dad for like a year or so. And you want to talk about that? Do you want to leave it? No, I don't want to talk about that the first session. I want to just talk about the fact that it maybe happened. And like, we're going to ease into that. It's a back and forth dialectical about how fast we do, especially trauma work. That's very sensitive. You probably don't want to force. It's sort of you let them lead a little bit, and you just kind of guide, keep them on track. You let them tell their story the first 1 to 3 sessions.
Then from there,
it's an art form. It's a complete art form, and you have to have reps. Like, you're a crap therapist for like the first 5 to 10 years you do it, and then you start getting good. That's why it's so hard. You need reps. Like you do. You got to screw up and learn some things. Like it's not an easy profession.
Yeah. I love the brutal honesty too that you're bringing here with this. Pushing a little bit more into that realm of understanding, like the good therapist versus more of an incompetent or just lesser one that might be a lesser fit. did want to talk more on some stats of just what we've been seeing out there, especially for men,
Mm-hmm.
trying to get through therapy because men, of course, we love logic, but we don't dive further
Mm-hmm.
past logic.
Mm-hmm.
So once again, going into a little different side of the topic of what makes a good therapist or a great therapist, even that can best support, especially men as part of this audience.
Mm-hmm.
I'm curious what some of your thoughts are into those areas and realms too of what you've been seeing out there versus what you've been doing. Because I know there's a lot of work you've been doing too, but also just from a more understanding of what can more best help, especially men.
Yeah, I was talking about this with Dewey Freeman on my podcast a couple weeks ago. He said therapy is kind of lost its grit factor. It's female dominated right now. It just happened that way. It's not anybody's fault. It's just all the professors and all the stuff is taught. That's not a word. Taught as if you're a woman, and it used to be the opposite. When Ford and Young were rocking it, it was like all male. It was like, yeah, Louise von Franz and Jung's daughter and like a few women were doing therapy, but it was like 90% men. Now it's kind of switching. It's like 80-20. More men need to sign to be therapists. And then I think it will naturally balance itself out. Right now, it's just the way it's taught is very feminine oriented. It's not bad. And some of that's great for men, but some of it just doesn't land right away. We are in our heads, and we do need to be trained to go into our bodies. But sometimes you walk in and the female therapist will talk to you as if you're another woman. And like Connor talked about this before, like they'll ask, well, how do you feel? And we're like, well, I think that, and so like, no, how do you feel? And they're like, well, I think that, no, how do you feel? It's like, oh, you mean emotions? It just doesn't land right away. Like, and if you see it, stereotypically speaking, when a female therapist and female patient sit down, they go right there. They go right to feelings, and they talk and they vent and they process things, and then they move out and then they feel better. Guys might not walk out feeling better that way. They might feel lost or confused, like what just happened. They also want to know, okay, what's the plan? What are we doing? Like, do I have homework? How do I fix this? Like, there's none of that sometimes. It's just like, well, let's process our feelings day in and day out. That doesn't work either. But we do need to be more in our bodies more. We are walking around as if we're just heads. I always ask, hey man, after I get to know them, I'll say, what's going on from your chin to your navel? Like, do you sense anything in there? Once you do this somatic work, how I work is I have a phase 1 and 2 and 3. Phase 1 is the intake paperwork, letting them tell their story, getting the blueprint, psychoeducation, what happened to you, making sense of what happened to you logically. Lori Gottlieb's book, maybe you should talk to someone. She calls Insight the booby prize. I call it the white elephant gift. Just because you know what happens doesn't mean anything goes away, right? And a lot of therapy. You just keep talking in circles about your story and almost like reinforces it and like crystallizes it as like, oh yeah, I'm a insecure attachment. Like, I think we were talking about this with Dewey the other day. I'm a Scorpio, and like, just the way I am. Like, I'm not going to change. That's phase 1 is you need that, but you can't stop. Phase 2 is like, hey, we've got the blueprint. Now we're going to put the blueprint to use. We found some trailheads. Now we're going to go down there. And that's usually in the body. It's usually a lot of like the Gestalt stuff we've been talked about, IFS, somatic experiencing, like not CBT. CBT is useful. It's like the Jungians always like to make fun of the behaviorists. The behaviorists will talk about the only thing that exists is what you can measure by behavior and thoughts. And that's it, full stop, which doesn't make any sense. Right. It's easy to quantify. So there's this funny analogy of like a behaviorist and a psychodynamic therapist are on a boat and they see an iceberg, and the behaviorist guy goes, oh, there's a piece of ice floating out there. And the psychodynamic guy goes, well, that's an iceberg. There's ice underneath the water. And the other guy's like, no, that's just ice floating on the water. And like, no, if you go beneath, there's a ton of fucking ice. And they have this argument about it. And then they jump in the water and they find out there's a big, massive piece of ice. That's the unconscious. That's all the shit that's in the body. That's all the stuff. That's phase 2. You got to go there. once you work through phase 2, you do some deep healing, you do some deep crying, you do some deep metabolizing, all the stuff we do kind of like at the men's retreats where you have an embodied experience. Like when what does Dewey say? You're wounded in relationship, you heal in relationship. When you were wounded, you had an emotional experience, right? You didn't have an intellectual conversation about it. It wasn't like a mind thing. Your body, your nervous system felt it. You have to go back and be in that state to feel it. You can't just logic your way through that. And that's a lot of therapy. Let's just logic our way through that. Nothing really changes. You just have a better understanding. But your nervous system and your unconscious is still there. Your inner child, so to speak, is still hurting. Yeah. That's phase 2. We got to go there and talk about that. Once you come out, that's phase 3 is optimization. Okay, we've come out of the hole. Now, how do we want to make this better? And you can toggle back between the 3 if you need to. But at some point, you get to optimization, and that's when sessions drop off. We come in twice a week, monthly, quarterly. We call it tune-up, or once a year, or whatever. That's optimizing. But phase 1 and phase 2 are the most important. And most therapists get stuck in what I call phase 1, where you're just talking about the story.
That's my experience in my past with some other therapists I saw for a few years. It was like, great, we had a great logical discussion. My behaviors didn't change.
Yeah,
I didn't feel change.
No, you get a cool understanding, but yeah, you don't feel like anything's happened.
Right. And there were a lot of things around that. It was just a logical explanation. He taught me a lot of things that he learned from his school in therapy. It's like, oh, it's this system and this system. Cool. Like, I get it. And yeah, I talked to him about some of the issues I was having or at the time, but it was all just up here. There was nothing that got more felt into here of an experience, or if it ever really got there.
Yeah.
And I even remember some of the boundaries they used, and it was like not being able to form a relationship with them either. They would say, oh yeah, if I saw you in public, I'll never talk to you. I won't talk to you unless you come up to me. It's like, yeah.
Sometimes there's some therapists will be like, I'm going to ignore you. I'm like, what the hell kind of therapeutic relationship is this? Like, I always say, like, oh, I won't approach you, but you can approach me. Or if you tell me now, if I see you, are we cleared hot to do that? Cool. And then it's not a thing. Like, that's so clinical.
It was more of that clinical established barrier. Like, unless you talk to me, it was like, but I didn't even have a choice. It was just, no, I will not engage with you.
This is bizarre. And do you want to see that guy next time? I'm not going to open it to a guy like that. I really don't care about you until you're paying me.
And not from now what I know and I've learned. There's a whole nother realm of therapy out there. So that's also another key point is I hear so many men and women say, oh yeah, I see a therapist, but it really just didn't do anything. Mm. Well, a lot of it probably was, a logical discussion. And you just went there as for a bitch session
or event session.
Vent out. Yeah. Mm-hmm. And just, or I shouldn't say that, but event session, just to say that. And,
those are useful.
It didn't go anywhere.
Yeah. You can't always be an event session. Sometimes it's useful to get too externalized for sure.
But every time
it's just going to get old.
It is very much phase 2, like you were talking about. That's where a lot of that stuff gets touched. And my experience, especially in the last year and a half, 2 years now, of where things have changed for me on that level, because it's that now I'm actually coming down into the body, the emotion, the actual really feeling, not trying to describe in my head.
Yes. That's what guys do in therapy. We do that. Mm-hmm. And women make the mistake with men is because I think women do this better than us because they kind of live in that area, stereotypically speaking. And so that's why it works female to female, and they talk and it goes there. If you try to do that as a woman to a guy right away, it's not going to work. You got to start with phase 1 and then go to phase 2. You can't go into phase 2. How are you feeling? That's phase 2. What's going on? And the guy's like, I can do anger and I can do depression. And what else do I have? Like, I don't know the plethora of emotions that exist in me. I've never gone there. I can postulate about them in my head, but I I have these sensations going on in here, but I couldn't name them. A lot of guys
can't even describe them.
No, they just feel something, and it's just like, I don't know, upset stomach or whatever. But yeah, there's a whole psychoeducation that goes on. Not all men. Some men can go right into phase 2. I've had that happen to me as well, and they're just already there. It's just a different flavor. But yeah, we're not, as therapists, we're not really trained to do that, and it's not good. But nobody's really thinking about or talking about it yet. I know Connor Beaton got to talk about this stuff at the Psychotherapy Networker conference with Dewey, and I hope it was well received, because we do need to be talking about the differences. Every training program I've been in, they're one of 3 men in a cohort of about 30, and 1 or 2 of only straight men. Like that, or the only straight guy. Not that that's bad. It's just like, know what's going on, And I was in my master's program, at right next to Naropa is University of Colorado. They called me the CU student that would go to Naropa, because I'd show up in my fucking Eagles gear, and like, nobody cared about sports in Naropa, and I had nobody to talk to. And they're like, you look like you go to CU. I'm like, sorry. I'm here to learn. It's a really good training program, but it's just very feminine oriented. This somehow got to change. My wife likes to joke when she works for an insurance company they call it behavioral health and insurance, which is a disgusting term. I don't know why they call it that. She does the credentialing. So when somebody wants to sign up to be on the panel, she has to like vet them, and she sees their like headshots, and she calls them the men with the soft hands. Like, are they like cardigans on? It's like the classic like cliche therapist picture, and she calls them men with the soft hands. She's like, I would never see a guy like that. Like, that's out there. It's not bad, but like, can that man handle another man? Like, I hope so. And sometimes they can't. Sometimes they don't know what to do with. That's a lot of masculinity coming at them in therapy they've not been trained to deal with, and they get scared, and because maybe their own masculinity has been repressed for so long, or they're taught, I have to be very feminine in my approach to therapy. I show up like this in my sessions sometimes. If people are watching me, sometimes I will show up like this with a fucking Eagles hat on. Like, fuck this shit, man. Like, we're bros, we're dudes. Like, and it works so well. And you can see when they first come in to see me, you can see like the, oh, thank God feeling come down. Like, you're on my level, you can just see it. You can feel it. It's more relatable. I don't always wear a hat and Eagles gear. Sometimes I'll throw a collared shirt on from time to time, but rarely am I in a suit or tie. Like, sometimes, but rarely. And it's just a thing that's got to change. It's probably different in the coaching space. I think the coaching space does a much better job about this, but in the psychotherapy world, we got some work to do.
Yeah. Plus more cardigans to hand out.
I mean, when you graduate, like, it's like the white lab coat you get for MDs. They should just hand us cardigans.
Yeah.
Here's your white cardigan.
I think you touched on a key point earlier, and I wanted to spend a little bit more time elaborating into it. Was the capability of handling another man's masculinity.
Mm.
There's more to that, and I wanted you to elaborate more onto that, because it's not just, it's like being able to have the confidence to handle a man's full range of emotions that are there in the
so they can feel safe. So
it's not violence, and it's not and it's not like rage. There's other, it's not like the crazy things that people think that a man would go into, but the components of anger, hurt, pain, sadness, and yes, varying degrees of it all too.
Mm-hmm.
But I think there's a fear of violence almost to a point. And
yeah.
Well, there is a little bit, sure, depending on the term.
Yeah.
But so I was hoping to hear a little bit more of your thoughts on that.
Well, just train in jiu-jitsu, see if like you can handle yourself. That always helps. Like, you can handle yourself. Yeah, you do want to be able to handle what comes at you, and that'll make them feel safe. I got a great experience. I'm just lucky. My post, what do they call it? Like, dude, you do a postdoc fellowship or is that what it's called? After you get your degree, you do internship hours to get your licensure hours. I got to work in the Boulder County Jail. Mm-hmm. And when you work with those guys, they shit test you to see if you can handle them. They throw everything at you. They tell you all the stuff they've done. They'll fuck with you. They'll tell you suck. And if you just sit there and take it and go, okay, yeah, and show that you're not going to be blown over, they start to trust you. And it was a beautiful test and a beautiful learning experience. I don't know why. I was more curious than scared. Like, the deputies are right there. I mean, you're not going to do anything to me. Like, you can yell at me all you want. Like, they'll just put you back in your cell. But that it was a beautiful experience. I felt like I did more healing work in that year time I was there than I've done in private practice. Because some of those guys are the most broken, hurt guys ever, had the most horrific childhoods. None of these guys were like, there was always a reason. I could see the through line to where they got to where they were. And some of these guys were doing short-term sentences, or they're waiting sentencing to go to prison, or they're coming out of prison, going into a halfway house. And I did group therapy with the guys too. And after a while, these guys, we became like, it was almost like a gang. Like, I was their gang leader. It was like the therapy guys. And I would walk into the pods without the deputies. I'm like, dude, how do you do that? What? You can just walk. Oh, I don't want to let you in there. You're going to be safe. I'm like, yeah, I'm going to be fine. I knew that if any random guy that I wasn't seeing fucked with me, those guys would protect me. That's how cool it became. And it was like, this is what guys do. We squat up. This is really cool. And it was cool to help the deputies understand what these guys are going through and help their relationships, because they were very like heavy-handed at first, and like, these guys are shitheads and blah blah blah. And like, if I talk about what some of these guys are going through, it kind of softened them a little bit, and I taught them a little bit of like how to talk to them without being so authoritative. I mean, you don't want to lose your boundary, of course. And it was really a great experience. If it paid me as much as I get paid now, I probably would still be doing it. It just didn't. You couldn't survive off what they paid, but yeah, it was a great experience. So handling men became really, really easy after that. It was really good. And they would regress back to little boys at some point with all their pain, and it just cry and tears. And it was just like so sad and so healing. Like, these big, tough dudes, just their inner children were just fucked, just hurt, just needing somebody to fucking listen and understand, on and off drug abuse and all the stuff they've done. So much shame. It was such good work. I really felt like I helped a lot of people. So I got lucky with that. I mean, if you can choose an internship or something, if you're being a therapist, to do it in a jail or a halfway house or something like that, I highly recommend it. If you're wanting to work with men, that's going to really prime you. It's going to be a good training experience for you. So that's good. You want to be able to handle what comes at you with men, and hold your seat and not get blown over. They will trust you more. They're going to see if you can handle them. If you can handle them, they'll feel safe, and then they will open up. If they don't feel safe, they're not going to say shit to you. They're just going to check the box or whatever, or just, you're going to do phase 1 for 2 years and nothing's going to happen, because they're not going to feel safe. Why would they go into talk about their inner child when they're scared to death that you're going to punish them or kick them in the nuts for it? Like, they're not going to. It just ain't going to happen. So I don't know if that answers your question.
No, it does. It highly relates to, I know for me, it took a long time to feel safe in a lot of places. I didn't feel safe because, I had anger to get out, and I thought it was violent.
Yeah, well, it is.
But in a sense of like going to hurt somebody, violent, wanting to do that. And because we have such fear, and exactly like you were saying earlier, fear of being seen on that level, of being seen as a violent man. It's like,
and being judged for it.
Exactly. That. Yeah. Yep. Exactly.
Anger's bad. You can't let it out. You have to be a nice guy. All that bullshit. Yeah.
Yeah.
There's a way to let out anger without like seeing red mist. Yeah. There's a way to do it. I mean, you went through it at the uncivilized retreat.
And that's exactly where I was referring to is that one of those moments, even though it was being witnessed by 25 guys or who are all everybody there, everybody in that room just was able to make me feel safe to share and to say, we can handle seeing you angry. We can handle seeing you what you think is violent and not judge you.
Yeah. Yeah. Because we are you.
And yeah, I was. And then I picked you to wrestle.
With my half-healed Achilles. Yeah.
But yeah. And it's that I think is a key part and beautifully explained of what it takes to make a man actually open up from being shit tested in a way to say, are you going to fuck with me? Are you safe for me to open up is a bigger question that would be asked. Are you going to punish me or judge me if I do open up, whether I show you all the grief, the shame, the sadness, or anger?
Yep.
And then can you handle it?
Yeah. Are you going to abandon me after I show you this?
Right.
Because that was probably a lot of the experience for a lot of these guys' childhoods. Yeah. When they showed emotion, they were told, don't do that, pay attention, you can't do that. Or parents got divorced and left and they thought that they caused it when they really didn't think so. They learned to shut that shit down. It's not good. There's a lot of research out there that boys feel more deeply than girls when they're young. It's new research. I can't remember who did it. I even saw it like dropping my daughters off to school. Like my daughter will be like, I don't want you near my friends. Like, let me go. But I see these like boys like clinging to their moms. Like, I don't want to go, and leave me. Like they're deeply feeling, and we tell them to like rub some dirt in it and get on with it. If a girl trips and falls, it's like, are you okay? If a little boy trips and falls, it's like, rub some dirt in it.
Yeah.
You're 4. Like, tell them that when they're 14, not 4. We kind of get conditioned this way. Like, oh, I can't show that side of me. It's a weakness, or people leave me. I better just shove that down into the shadows. And then it comes out as rage later, or addictions or whatever. It's not a good cultural message. Later on, different story. But when you're a little guy, come on, man. They're kids.
Yeah. Well, I want to flip the script for a second. Because that was absolutely a message you were grown up with. I was grown up with, you're a boy, don't cry, those types of things. Mm-hmm. But now I feel like the script's almost flipping too far to the other end.
Like you got to feel everything, and not have any boundaries. And we've over-indexed in a way, I think, culturally. And then teaching girls that you can be a boss bitch and badass and hardcore and like don't take shit. Like, yeah, that's good, but like, are we crushing their femininity too? Like, there is a balance, men and their brains of girls and boys are different. I'm sorry to tell you. Like, there's a good Huberman Lab episode recently on this topic with the data that states so, with variances and differences, but there are differences, and in Jungian psychology, there's the anima and animus, masculine and feminine energy within us all, and it's the yin and yang in Eastern religions. It's a thing, and we have to be careful with what we suppress. That's natural. Yeah. And people need to make their own decisions too, of course, but when it's like you have to be this and not that, that's when it gets really dangerous.
Yeah.
We have to be careful with that. But yeah, that there is an over-indexing on, and it's good in a way, like talking about mental health, but like people are like identifying with their disorder now. Like, I got my diagnosis and I have this one and I'm frozen in time. And like, yay me, badge of honor. I can be fucked up the rest of my life and not have to take any responsibility. That's not what we're trying to do with
your
therapy.
Participation ribbon for participating.
Exactly. I'm anxiety. Woo! Not first place. I just participated. Yeah, we don't want to identify with our diagnosis or what's going on. We want to heal through it. That's just the first step. It sometimes does feel good to get one and like, okay, now I know what's going on, but like, you got to keep moving.
But it's that identity part. Like a label can be okay, but when it gets assumed as an identity, that's
your host.
Your host.
You're not going anywhere.
Yeah. And now that's your thing anytime you do anything. Because to me, identity is what you put into the things that you do in life. Like your work, your being of a father or husband, and that's your identity. And if this now becomes a part of that, well, so my anxiety is now part of being a father.
Well said. Yeah. It will bleed in for sure.
But it doesn't have to be.
No.
You may feel it. That's okay.
You're supposed to.
Yeah. But doesn't mean, oh, I'm an anxious dad.
Yeah. Stamp.
Very, I mean, yeah, it's more what you want to say that you put in is, no, I try to bring a level head, balance, and embodiment to my children as a person into practicing of being a father or husband or whatever I do for work.
Yep. Always learning and growing.
Yeah. And I think that's another place too. It's the labeling we've been placing onto men. The labeling of, oh, you're either violent or this or that. And I'm curious too if what you've seen, if you've seen that in therapy, is placing labels.
Say more. What do you mean?
So seen it out there with other therapists to say, is this a thing like what a good therapist would do to help you identify something versus labeling you as something? I'm curious
Have
if
I
there's
seen
anything
that?
around that. If not, it's okay. But
that's the other problem with private practice is it gets very lonely. You don't, unless you get other people in your suite. So you don't get that crosstalk, like water cooler talk often. I don't know. It just seems like maybe that's happening a little bit. I just hear anecdotally about things like that, or you go through your social media and you see stuff like that happening. I'm not sure entirely.
okay. No, I was just more out of curiosity, thinking, what's being seen and out there on that level, but diving more, let's say, I'm trying to think what the next part I want to ask too. All right. So I think now I know a question to ask you is, so being a man and what might help men on this podcast is when I'm looking for a therapist, what credentials am I looking for? What key terminology, maybe trainings that therapist has done. And then what are maybe some of the things in the first few sessions, even I know before a relationship's built, but that I should start to make sure that I'm hearing or progressing towards a relationship with a therapist.
Yeah, this is the fun of where we are right now, because it's kind of like online dating. When you're looking for a therapist, you go through psychology dating, you scroll through profiles. That's where we're at.
It's true.
I read what they say. If it resonates, that's good. If they have a cardigan and soft hands, probably not. Just kidding. If the cardigan and soft hands work for you, fucking do it. PhDs are psychologists, MA, and LPs, LCSWs or social workers or master's level.
So
it's hard to say. Time? PhD is psychologist, MA, master's, and a social worker is LCSW. So LPC or is usually the master's level one. It's every state. It's so goddamn mind boggling. Why can't you just make it the same? Like there's LMHC in New York or MFT in California. It's LPC here in Colorado. Like, can we just make it the same thing? Like psychologists have LP, licensed psychologists. It's not something different. Social workers even mostly the same, but sometimes they have different acronyms. So it's hard to say. Some social workers are the worst ever. Some are really, really good. The problem with social workers is they get a lot of training in a lot of areas and not a whole lot in therapeutic relationships and counseling. That's just one segment. They get grant writing and hospital admin. And they're like the Swiss Army knives of our field. They can do everything. Whereas we're taught one thing, therapy. So I would just err on psychologists and master's level. Social workers, you want to make sure they've been doing it for a long time and are good therapists, because they have to do a lot of extra training that they don't get from their programs, because they're not just getting therapeutic relationships. They're getting all kinds of shit. But they can do all kinds of shit. So it's hit and miss. I personally had one male therapist who was a social worker who was amazing, but he was also went to Zurich to the mothership and trained as a Jungian analyst. So he brought that back. So he was a social worker but he was a Jungian analyst. So he was great. He was like a Jedi master. So social workers, just, I wouldn't say bad, just caveat emptor, buyer beware. Just read the profiles and what they sound like, where they went to school. You can look up the school and see if that seems like it was a good training program. You can do some recon.
Any styles? So
styles, yeah.
Like Gestalt, Jungian,
yeah,
schools of thought.
If you even know what the fuck that is the problem. Some people are like, I hurt. Oh, IFS. What is that? Like, they have no idea, you know. If you know about that, then yeah, on the drop-down menu, you can select for some of these things. But it's usually pretty vague, like anxiety, depression, PTSD. Like, it's so nebulous sometimes.
CBT. No.
Yeah, that's always on.
Filter out. No.
Everybody gets CBT. Even physicians get CBT, like, because it's the gold standard, and it has its place for sure. But it's all phase one work. Like it's definitely helpful, but you can't stop there. And then there's a chemistry thing. So once you've done all this brain damage of having to online date and swipe right or whatever, you land on like 3 that you think are potentials, you got to shop. I say give them 1 to 3 sessions and you'll know. Like, shit test them like the inmates did with me. Like, get after it. Like, see if they can handle you, or ask hard questions. Ask, do you see a therapist? See how the chemistry is, you know, and if it's not there after the 3rd session, you'll probably know. Or you can say, hey, this doesn't feel like I'm getting anywhere. Are you feeling that too? And see how they respond. Sometimes it gets their attention. They go, well, let's go this way. And you've unlocked a pathway, and all of a sudden it's great. Sometimes it just doesn't land. You're like, I think I'm going to pursue it with this other guy over here.
Yeah, you're looking for the long-term relationship, not the Tinder one night stand on those.
Totally.
Sites. Yeah.
Totally. Yeah. We're not doing that. You're not going to get very far. You're going to walk out not feeling so good. But yeah, you have to give them. I mean, sometimes the first session's so god awful, you're like, no, this isn't going to work. But you'll know. But give them a little time, because there is some warming up to each other period. You also see a PsyD, which is, I call the cheater's PhD, and I kind of wish I would have done it, because you don't have to do a dissertation. You just do more clinical hours. I think you have to write some sort of big paper at the end, but to my knowledge, I could be this wrong. To my understanding is you don't have to do a dissertation. I had to write a 350-page paper that sucked, and it took 7 years.
Wow.
I lost a lot of brain cells doing. I probably would have done this ID program if I had the option. My school didn't have it at the time. So if you see PsyD, that is still it's just a PhD. It's a doctorate of psychology, or PhD means doctorate of philosophy. It doesn't matter what industry it is. It's doctor of philosophy of
something.
Yeah. What is like Dr. Huberman? He's a doctor. Neurobiology. That's what it is. But he's a doctor of philosophy in like neurobiology, or whatever his credentials are. Ophthalmology is another one of his. So you have to do a lot of recon, which is unfortunate these days. Or another good one is if you know a friend who's getting something out of their therapist and it's clicking, you can do that. You can get like word of mouth referrals are good. Social proof, like, oh, this person's been great, or I heard my buddy's seen this guy and he sounds great. I get a lot of referrals that way, like from my patients or their friends talk about me, and then they come see me because of that. That's a really good one. So if you ask your buddies, you'd be surprised how many people are in therapy that just don't want to talk about it or tell you. And if you say you're looking for a therapist, they'll say, oh, well, I see a therapist. Like, you do? You're like, oh yeah. So sometimes that's a way in.
Yeah.
But it's a long process sometimes.
And it should be if it has to be, because you are finding somebody that is handling your mental state and your mental well-being, and a person that can unlock a lot of future potential in you
and hold that
by healing you and helping you heal.
Yep.
So even the same thing goes with coaches, but I think beautifully stated there is take your time to shop and find the right therapist. Make sure that they're saying the things that help you embody too, or at least get to a point. I know with that relationship early on, it's tough, but finding the right therapist, the right coach will just accelerate your life much more than spending years. And I've done it, spending years with a therapist that was purely logical. Nothing really changed in my own behaviors for that time.
Yeah, it's worth it to get it right.
Yeah. So just to wrap today's episode, I do want to ask just one question.
Yes, Eagles will win the Super Bowl again.
Not that. No. If you had one more piece of advice you want to give men that are listening out there, that, whatever it could be for helping them in any facet in life, what would that one piece of advice be?
Have more male friends. It's either you have too many female friends, which I don't understand personally, or you have no friends or one. Have more. Go get more. Find out ways to do more. Go get into jiu-jitsu. Easy, ready-made friendships. Go do some sort of event. Go on meetup.com. Just have more male friendships in your life. Super, super helpful, because that's a first good taste, was like to talk about your stuff with someone else who gets you and can hold you. And, if they can't handle you in that way, then it's not a deep friendship. When you get deep friendships, you can do this. And it's not like you're doing therapy, but you get a feel for what that's like. So, and also when you have a therapist, you only see them once a week. If you need to talk in between, sometimes you can't, but you can talk about stuff with your friends, and it gets you over the hump until you see your therapist. And we're isolating, and it's not good. It's really, really not good.
Yeah.
And be brave, because we're all walking around thinking we can't bond with each other or be open, and it's such crap. Like, we've seen at the retreats we've done, like, we're broing out and bawling and crying in like the first 4 hours, like horse shit. Like, you can definitely do it. We're made to do it. We did hunting parties for hundreds of thousands of years, squads. We can bond. We can talk about stuff. We can have conversations of depth. That's important.
Yeah. Beautifully stated, brother. Yeah. Now that having good quality male friends that you can bond with on that level. Yeah. Beautiful.
It's different with girl-friends. You can have them, but I think it's harder for guys, because in the back of our minds, we're always wondering if it's more, or what do they like me. It's easier for women to have male friendships, because guys, I think we always think that they like us, and they're not thinking that. They're just like, no, we're friends. So it can happen, but it's different. It's okay. It's fine and great to have a few, but I think it's totally different to have man-to-man relationships.
Awesome.
It's just got to be balanced out, I think.
Awesome. Well, it's great seeing you again. I appreciate your time today. How can people reach you?
In the show notes you're going to provide.
Yep.
Because I don't even know what my Instagram handles are. I know my podcast is Miles Ahead Pod on Instagram. I don't even know what my professional, where you can find me to sign up for therapy one is.
It'll be in the show notes. We'll put
my
it
website.
Yeah.
Put it, just scroll down. It's going to be in there. Scroll down. My podcast is a Miles Ahead podcast. You can find it wherever podcasts are, or YouTube. And this guy's been on mine, like 3 times? You've been on mine, like
3 times now.
Yeah. So
I'll put the
come on over
in the bottom too. Yeah.
Yeah, link them. I think it'd be cool.
Yeah.
They want to get to know you better, because the first time you came on, you got deep.
Yep. Yeah.
So your listeners may not know you as much as they need to.
No. Thanks for your time again. Great seeing you again.
Likewise.
Hope to have you on again soon.
But yeah, we'll do it for sure. And vice versa.
All right, brother.
All right,
Thanks.
we're out.